Hello, my name is Mohammad Ghaznavi. I'm one of the interlocutor right now in this session. So with us is Dr. Faraz, right? So we'll be practicing this session. It's about the medical power of attorney from OET medicine. Why we have selected this session? Because it's one of the unique session and most of the people are really concerned and confused about the session, specifically with reference to start. So we would like to start this card, but before that we will have a warm-up session. Sir, in the warm session, the interlocutor is bound to tell you about the exam. Like we have warm-up session first, followed by the role play card. You will be having 2 role play cards, one by one, profession specific. Per card, you will be having 3 minutes time. You can take the notes during this time. You can ask any question from the interlocutor if you are having any. That is followed by 5 to 6 minutes time. In the 5 to 6 minutes time, this card will remain with you, and you can review the card time and again. Right? You can make an eye contact as well, or you can review the card time and again as well. So after 6 minutes time, the time will be up for the session, and the interrogator will give you the next card. So if you're ready for the session?
Yes, I'm ready.
Okay.
Good afternoon, Mr. Anthony.
Good afternoon, doctor.
How are you today?
I'm not well, doctor.
What brings you to the hospital?
Well, actually, I'm having this motor neuron disease. It's quite in the advanced stage. So I'm quite concerned about that, like my son is not living with me.
Okay.
So I just don't want him to be my attorney. I'm not relaxed and comfortable with him.
Okay. Why are you appointing medical power of attorney?
It's in the advanced stage I'm having this disease, right? So I was looking, I don't know if I have to appoint someone or not.
What is your knowledge? What do you know about medical power?
I don't know much about that. I just searched Google. I came to know that it's about a person who can take a decision on behalf.
Okay. Okay. Let me tell you one thing, that it is not necessary to appoint a medical power of attorney.
Oh, wow, that's great.
No one can implement that he is your medical power of attorney.
Doctor, actually, my son is not close to me. He just want to be my attorney. I don't want him. And it's not
if
being
you
close.
If you don't want, then nobody can implicate himself or herself as your medical power of attorney.
That's great, doctor.
And now,
one more question that was in my mind always, doctor. Like, as in advanced stage of disease, so I'm quite concerned if my son can declare himself my attorney.
He cannot declare anything.
He's a lawyer. He's working as a lawyer. So I'm afraid all the time that he can take the signature, drop the down in the hospital, and he can present the document that my father had given the consent. So this is in my mind, like if I would be in a stage of life that I'm not in a mental health, would he be able to take the decision on behalf?
No. This is not implicated all the time. Actually, you can appoint anyone as your medical power of attorney.
Oh, that's great.
And this is not the time. You can plan an advanced care plan so that you.
Before that, I would like to ask you, as you mentioned about advanced care plan. So I was thinking if I can appoint someone as my medical power of attorney, he would be able to refuse my last day care or my mercy killing?
Yes, he can refuse.
Oh my gosh, I searched over the internet. I was of a mind that he might not be able to refuse it.
Yes, he can, but if you appoint someone who is not close to you, that's some other than your son or your daughter, then he may not be able to do that.
But I'm saying that if I can appoint someone as my medical power of attorney, so would he be able to take this decision on my behalf to...
No. This is not.
Yeah. That was concern about. You were telling me that he would.
He cannot do.
That's no peace of mind is there. That's fine.
So you should plan. You should plan an advanced palliative care for your disease. Your disease is progressing, and ultimately, God forbid, that stage came when you will not be able in the state of mind. Then someone will hit there to take some decisions regarding your.
So what needs to be done then?
You should appoint someone.
I would appoint someone, but I know one in my life, that I can appoint someone. You're telling me about advanced care plan.
Actually, now today you are in a good state of health. You can actually write today. You can give your advanced plan to the hospital, to the state, so that at the end, when you are not in the good state, that will be implicated.
So no one else.
You will make your own decisions today. That will be implicated.
Oh, what I can understand that you are saying, if I have to write a will. And according to the will,
we will be obliged to do that.
That's fine. That's great. Great to know that.
Yeah. Is there anything else you want?
No, it's fine now.
So I think our session is complete here.
Thank you very much.
If there are any questions, you can contact me anytime.
Thank you. Okay, let's have a feedback on that. This was a different card about the medical power of attorney. one of the unique card in our setting in Pakistan, India and Bangladesh. People don't have such type of scenario. So plus point, you have started appropriately. Your start of the card was fine as per the setting. You have asked about the knowledge of the patient about medical power of attorney. That is additional point. Most of the people do miss this thing in the
Empathy
card.
was good.
Yeah. Followed by the fact that there was one mistake as per this card is being mentioned that it's your call. If you don't want to appoint someone, it's totally fine. But you have you have mentioned this thing to the patient that you have to appoint.
Okay, it cannot arrange.
You have to appoint. So
Yeah, that's my
basically,
mistake.
this is the point of assurance that you have to give to the patient that appointing someone or not appointing someone, it's your call.
Okay.
You don't need to be worried about that. It's not necessary, right? Anyhow, then you can ask the patient a personal question. Do you mind if I can ask a personal question? Are you not being close to your son? Then he will tell you that since the death of his mother, we are not living together. Secondly, the second point was addressed appropriately. Then one should need to be in a good mental state of health. Regarding the advanced care plan and the palliative care, it's not a job description of the medical power of attorney. They can accept or refuse the palliative care. That point was not understood. That's our last point.
Okay.
That point was not understood. Then in the last, you have to offer him
The advanced
right
care
away.
plan.
Yes.
Yeah.
So this was a different card. As we have done this card, he was fluent. The plus point, the start was appropriate. He explored the patient knowledge about the MPOA. And even some close-ended question related to the relationship of the father-son was missing with the positive note. And he also have assured that it's not necessary for you to appoint someone. He also have assured that one should be in a good mental state of health. But you missed the point, the first one, that it's not necessary for you to appoint someone as medical power attorney. So apparently speaking was fine. If you're a fluent person, you have asked the patient knowledge and concern. So with a good note, I believe that you'll make it. But just work on those areas.
Okay.
We try to address the minor parts as well. We'll try our level best that we can grade you in such a way that we can fail you on a minor mistake. I know it might be negative at times. That's why I normally don't recommend my student a grade. But why we want to do this? So that you can achieve a good score. We want our system to be developed in such way that if you are getting 350 over here, in the real exam you can get 400. So for that reason, we have to pinpoint the minor mistake as well from linguistic as well as from the clinical side. So this is it for today from my side.
We will get 3 minutes time to read the card.
You will get 3 minutes time to read the card and 5 to 6 minute time for the session. Now you'll get some feedback on the session.
Hi, my name is Dr. Faraz. I am here in M&M Academy and preparing for the OET exam. My experience here is very good, extremely good, and that every day we practice something new. And I just want to suggest one thing, that practice makes a man perfect. Do practice, do join, and do participate in the interactive session. That will help you a lot, and inshallah you will all clear. Thank you.